As a medical doctor, I've been taught to trust the science. I've asked thousands of my patients to trust the science as well. But after taking care of numerous vaccine-injured patients over the last few years, I truly believe it's time for the conversation to change. The simple fact is there are some vaccines that for some patients will cause harm. And later in this video, I'm going to give you 3 specific examples of patients that I have cared for that provide further proof to that statement. There are 2 big reasons that explain why the medical community is losing the public relations battle with vaccines. The first reason is the medical community's refusal to acknowledge the potential risks and harm that come with certain vaccines, because all you hear about in the media is how safe and effective they are.
And vaccines remain proven to be safe.
And you need to trust the science.
Because I represent science.
I'm sorry for interrupting, but as I'm editing the video, I came across more vaccine data that just highlights one of the main problems that I'm trying to discuss in the video. It's garbage data that we're asking our patients to trust. Look at this data about RSV vaccines being given to adults. They found 131,000 participants, which is a pretty good sample size. They randomized half of them to get the vaccine and half of them to not get the vaccine and see how many ended up in the hospital. Of the 65,000 65 years and older patients that got the vaccine, only 3 ended up in the hospital. That's a pretty good number. But look what's more interesting. Of the 65,000 that didn't get the vaccine, only 18 ended up in the hospital. And it didn't even study whether the 3 that got the vaccine or the 18 that ended up in the hospital actually ended up dying. Did this vaccine based on this study save lives? Who knows? But 15 people didn't end up in the hospital. That's significant, right? Well, let's look at the data to see if it's actually cost effective. According to the very data that studies this, maybe. So this is the science that we're asking people to trust. It's garbage science. It doesn't even study if deaths are actually being prevented, and the study itself was basically done by Pfizer. They make the vaccine, and if this is the best data they can produce, it's really suspicious.
Because I represent science.
So you've got a vaccine that you can't even tell if it's cost effective to use, being given to people to prevent only a handful of hospitalizations, and we're not even know if it's saving their lives. But using this garbage data that the company produced, Pfizer is going to make billions. And that's one of the main problems. The general public is becoming wise to these tactics, and it's driving vaccine hesitancy, and it's pushing our patients away. All right, a quick aside, and now back to the original video. I took care of a vaccine-injured patient a few months ago, and that story is coming up. It's crazy. But it shouldn't be. Vaccines are safe and effective. Physicians like myself should be providing all patients data about the risks and benefits and harm associated with some vaccines. Tylenol is safe and effective, but if you take it inappropriately, it will kill you. And trust me, having personally taken care of both intentional and unintentional Tylenol overdoses, it is a painful way to die. Risks and benefits. The second reason the medical community is losing the battle with vaccines is the establishment's refusal to admit it makes mistakes. Why should we demand from our patients trust when we as a medical community have not been more open about all the mistakes and unintentional harm we have caused patients through medical guidelines and practices that were ultimately deemed harmful? Did you know there is a study that reviewed practices and found that 40% of the time established practices either showed no improvement or they caused harm and needed to be reversed? We now know that up to 90,000 women died prematurely because of bad data dealing with hormone replacement therapy practices. And many more women often suffered unnecessary bone fractures after the data was interpreted more closely.
Because I represent science.
Doctors, myself included, we make mistakes. We follow guidelines that sometimes change. And later in the video, I'll tell you how up to 60,000 kids died because parents followed science that was written in a book back in the 1960s. Unfortunately, vaccines have become like every other hot button topic in the world right now. Incredibly polarizing. And in some ways, it's actually gotten partisan, which is the worst part about it all. The medical community has begun behaving like people on the far right or the far left. You have to pick a side, and there is no compromise. So in the case of vaccines, you either get all the vaccines, or the moment you start raising questions about some of them, you're considered an anti-vaxxer. And just like all the other polarizing issues in the world right now, the actual solution to the current vaccine problem and the lack of trust from the general public is somewhere in the middle. Does a rotavirus vaccine in Africa make sense? Absolutely it does. Does that same rotavirus vaccine make sense in most parts of America? Well, I'll show you the data in just a second and you can decide. The video that I'm going to show you is one that I made a few months ago, but I ultimately decided not to post it because vaccines have become so polarizing, and ultimately the tone of the video was almost as if I was attacking Dr. Mike, which, let me be clear, isn't the case. Dr. Mike does a lot of incredible good with his platform, and I definitely don't want to beef with somebody who has 14 million subscribers. A conversation maybe. But it's clear that he and a lot of physicians are dying on the all or nothing vaccine, and RFK Jr. is the enemy hill. But again, I finished the video several months ago and I decided not to publish it until his most recent podcast with Dr. Novella. I didn't know who Dr. Novella was, but the title of the podcast interview intrigued me: How to Debate Anti-Vaxxers. It's interesting, if you look up the video right now, the title has changed, probably because it didn't have anything about actually debating anti-vaxxers with counterpoints. But that's beside the point. But it's a topic I'm interested in, so of course I listened. Dr. Novella apparently is a neurologist who began writing the Skeptic's Guide series, incredibly popular books. But my first impression of him is what he says about RFK Jr.
The poster child for this phenomenon right now within medical circles is RFK Jr., right? And I do think he probably is a narcissist. Again, I hate to diagnose people remotely, but
That's just like all left-wingers calling right-wingers Nazis and all right-wingers calling left-wingers fascists. Attach a label, attack the label, but don't really talk about the substance and the actual person and the character. The second interesting thing that kind of caught me off guard was,
I've been following this guy for 30 years, not just the last year when he was HHS secretary, because this guy's been a menace for a long time.
for 30 years, like you've been watching him since 1996, I kind of find that hard to believe. But regardless, my third and final straw in the video is where he essentially says, trust the experts.
Find out what the experts are saying. That's the answer. Essentially, institutions that are dedicated to science, that are not dedicated to a product or a conclusion.
And what's even more interesting is he says you need to trust institutions and companies that don't have products. I'm pretty sure vaccines are products, and there are a bunch of institutions and companies that sell them. So are we supposed to trust them, or are we not supposed to trust them like you say? So the point is, I've changed my mind. I'm going to show the video. It's going to start right now. But just know it's not an attack on Dr. Mike. It just highlights all the physicians that behave like Dr. Mike and have that mentality, that all or nothing response that's pushing our patients away. That unwillingness to support healthy skepticism among our patients and support families who have legitimate concerns is harming the physician-patient relationship. So without further ado, here's the video. Dr. Mike has made no secret he's not a fan of Robert Kennedy Jr.
RFK Jr. is decimating public health.
He was very quick to release a new video about how the CDC's new vaccine guidelines are going to increase your child's risk of death.
You will hear news of more deaths in the unvaccinated.
And what was interesting after looking at his video, his counter recommendation to the new guideline was,
So what should you do as a parent or caregiver? Call your doctor. Ask, what do you recommend?
yeah, speak with your doctor, get more information, which is exactly what the new CDC guidelines are recommending. Before I break down my disagreements of his video in more detail and why I as a medical doctor agree with the new CDC guidelines, let me tell you the first of 3 vaccine stories regarding patients that I've personally taken care of. My first and most recent vaccine story was a patient that I had a few weeks ago. He presented to the emergency department complaining of some non-specific knee pain. His laboratory studies and x-rays were ultimately negative, and I decided to treat him in the standard fashion using the Rice protocol. I was going to add some anti-inflammatories, and that's when he told me he couldn't take ibuprofen class medications. I asked him why, and he said he was on blood thinners. Blood thinners, of course, aren't the most common medications for people in their 30s, so I asked why he was on them, and he said he had a history of a blood clot, specifically a saddle pulmonary embolism. And if you're not familiar with the saddle PE and how dangerous they are, they kill approximately 10% of the patients that get them. They are incredibly life-threatening. He told me he was diagnosed with a saddle pulmonary embolism after getting the COVID vaccine. My point for this story is this man was incredibly healthy. He was in the military and he was forced to get a vaccine that he didn't need, and now for the rest of his life he's unable to take ibuprofen type medications even for simple knee sprains. He developed a clotting disorder because of the vaccine. And those aren't my words, those are the words of his hematologist who told the patient the vaccine activated a clotting disorder in him. And you might be saying to yourself, well, that's a complication from an adult. This is a video about childhood vaccine schedules. So let's get to the video.
Vaccine schedule, and your brain went, wait, did we just lose access to vaccines? Take a breath.
I don't think anybody stopped breathing. So over the next few moments in the video, he goes on to talk about how some vaccines now no longer have a hard recommendation from the CDC and fall into a third category, basically saying administer based on shared clinical decision making. And let's look at which vaccines they're talking about.
Influenza, rotavirus, RSV, hepatitis A, hepatitis B, and meningitis vaccines. Folks, these are not benign conditions.
Okay, first off, let's talk about the rotavirus vaccine.
50 to 70,000 kids were hospitalized with rotavirus before the vaccine was around.
Okay, 50,000 kids were hospitalized with rotavirus. Not insignificant, but what's important, because in this video you talk about increasing deaths.
Deaths in the unvaccinated.
How many kids died of rotavirus? And if you look at the CDC data, it's anywhere from 20 to 60 kids in the United States annually before the vaccine was introduced died of rotavirus. 20 to 60. But we have a new vaccine, and so you would think ever since it started being administered, those 20 to 60 deaths annually would now be a number significantly reduced, right? I mean, we have vaccines. So if you go to the Children's Hospital of Philadelphia and look at their statistics on how many kids are dying of rotavirus annually in the US, it's basically the same amount. Instead of 20 to 60, it's 20 to 40. Well within the margin of error is the same exact number. But let's take a step back, because Dr. Mike, you and I both know those 20 to 60 deaths of rotavirus in the US, without having any insider information, are most likely deaths within lower socioeconomic families who have worse healthcare outcomes across the board. But who cares if the number of deaths aren't going down? Vaccines are safe, right?
And vaccines remain proven to be safe.
Let's look at the safety data from the CDC themselves. For every 100,000 vaccines we administer, 6 kids are getting intussusceptions. And if you're not familiar, bowel blockages. A bowel blockage is a significant complication in a young infant. So if you do the math, we administer about 2.5 million rotavirus vaccines annually. And if 6 in 100,000 kids are getting bowel blockages, we're not lowering deaths, and we're increasing the amount of bowel blockages going on. We're basically causing hundreds of bowel blockages each year that didn't have to happen to have no difference in deaths from the rotavirus vaccine. So do we continue to inoculate the entire population of rotavirus, or do we focus on improving access to healthcare to lower socioeconomic families so those deaths that do happen, regardless of whether they get the vaccine or not, might be prevented? And before we go any clearer in the video, I am not, as a physician, against vaccines. A rotavirus vaccine in Africa makes perfect sense. Not giving a healthy child a rotavirus vaccine in the United States kind of also makes sense too. Next, I want to talk about the hepatitis B vaccine and why it's ludicrous to recommend a vaccine for a sexually transmitted disease to a newborn. But first, let me tell you my second vaccine case. I was just out of residency. The year was 2012. My mother had brought her child to the emergency department where I was working at the time. He was maybe 12, 13 years old. He was nonverbal and he had a profound developmental delay. I asked the mother as part of the history taking, was this from birth? Was there an accident, traumatic brain injury? What happened? The mother looked me in the eye at that time and told me he was a completely normal child until he received a particular set of vaccines. Now, at the time, I didn't pay too much attention to the vaccines that she said. This was approximately 15 years ago, and this was well before the association of vaccines and potential autism was getting mainstream. In fact, I think the only person at the time who was talking about it vocally who had a platform was Jenny McCarthy, and she was getting ostracized for it. The point is, this mother didn't have a book to sell. She didn't have a podcast. She was just a mother who, in the privacy of an emergency department room, looked me in the eye and told me her child was normal until he got his vaccines. Again, do I personally think vaccines are the sole cause for autism? No. But do I think the perfect combination of some vaccines, genetic predisposition, environmental exposures, pollutants, heavy metals, that perfect recipe comes together and causes problems? Probably. There has to be some signal in the noise, and some of that signal points to vaccines. Is that signal correct? Well, time will tell. Let's talk about the hepatitis B vaccine. And it's funny how in the video, when you talk about kids not getting the hepatitis B vaccine, you show kids on a ventilator. I guarantee you that kid is not on a ventilator because he didn't get his hepatitis B vaccine. Are you sure you're not trying to fearmonger?
I'm not one to fearmonger.
Many people, of course, argue the hepatitis B vaccine is not necessary at birth because it's sexually transmitted. Now, you argue in your video that the data show thousands of kids in the United States are still exposed to hepatitis B and contract hepatitis B annually. Okay, let's look at the data. We found there is little horizontal transmission occurring before 6 to 8 weeks of life among children with hepatitis B surface antigen negative mothers, and there is no significant difference in infection risk between the groups starting vaccination at birth and those started vaccination at 6 to 8 weeks. And that study is done in Africa, where the risk of hepatitis transmission is far greater than it is in the United States. So for a family that doesn't want to put a vaccine for a sexually transmitted disease in their child minutes after they were born, there are data out there that support that decision. So why are we as a medical community fear-mongering them when we should just say, okay, we'll see you in a couple of months when you might want to reconsider? But the medical counterpoint is vaccines are proven safe, right? Trust the science.
I represent science.
The science changes. Heck, within the last 25 years, pediatricians can't come to a consensus on when is the appropriate time to give your child peanut butter. And I suspect the science on vaccines is way more complicated than peanut butter. Parents trusted the science and recommendations of Dr. Benjamin Spock, who literally wrote the book on how to raise healthy children. Unfortunately, in his book, he recommended newborns be put to sleep prone or on their stomach to avoid aspiration and unnecessary death. Well, the science changed, but not before nearly 60,000 kids were killed based on those recommendations. But you say no research is being done. But the CDC literally says on their website they are doing placebo-controlled trials. So do parents continue to give vaccines to their children the way they've always been done? Or do they follow these new recommendations, slow things down, and trust their guts? How can anybody say who's right at this point? My third and final vaccine story for the video. I personally had to take care of a 10-year-old child with measles the other day in a very busy emergency department. The kid's going to be fine. He had fever, some diarrhea. His rash was already disappearing. Was the visit frustrating? Yes. Was it unnecessary? Yes. The parents hadn't vaccinated any of their kids and all their kids had measles. It was frustrating, but with all the confusion, I understand. And I didn't make them feel guilty for not wanting to vaccinate their kids. And to be clear, I vaccinated my kids. Mostly. There were some that we withheld because of my family's lack of risk factors and personal beliefs. My kids got the hepatitis B vaccine later, not moments after birth. It was several months later. I don't remember. I'm pretty sure we didn't give them the rotavirus vaccine because I wasn't concerned about that. And we withheld a few more, but that's a personal family decision based on our beliefs and our doctors and myself. And it's not the purpose of this video. The purpose of this video is for you to make your own decisions based on your discussions with your primary care doctor. And you know what's funny? That's ultimately the recommendations from the new CDC guidelines. Gather as much information as you can and talk with your provider. And Dr. Mike, to you, maybe as physicians, we can understand where some of this vaccine hesitancy has come from. Because if you look back recently, we've clearly made some mistakes.
Because I represent science.